Hello, in this video I'm going to talk about the different types of viscoelastic materials used in ophthalmic surgery. When I'm talking about the viscoadhesive or the viscodispersive material, I'm basically talking about honey because its characters are very similar to honey. And when talking about the viscocohesive material, I'm basically talking about Jello because its characters are very similar to Jello. So in this video, we are going to talk about the difference between the viscocohesive and the viscodispersive materials, and we are basically talking about the difference between Jello and honey. An example for the viscodispersive material is the methyl, which is the hydroxypropyl methyl cellulose. And an example for the viscocohesive material is the helin, which is sodium hyaluronate. The viscodispersive material is less expensive, while the viscocohesive is more expensive. The viscodispersive material has lower viscosity and lower surface tension, just like honey, and the viscocohesive material has higher viscosity and higher surface tension, just as Jello. Starting with the viscodispersive material, let's start talking about honey. Look at the consistency of the viscodispersive material when it is injected outside the eye and even when it is injected inside the eye. And now moving to the viscocohesive material, let's start talking about Jello. You can see the consistency of the viscocohesive material when it is injected outside the eye. And here you can see the consistency of this material when it is injected inside the eye. Just notice the material that is getting out of the MVR incision, which is looking like Jello. The viscodispersive material is used mainly for coating the surfaces and lubrication during cataract surgery. So it is used to cover the cornea and used for lubrication of the injector. It must be used in cases of opening of the posterior capsule or in coating of the endothelium. And regarding the viscocohesive material, it is used for space maintenance during capsulorhexis and IOL implantation. It must be used in cases of intumescent and pediatric cataract to prevent extension of the capsulorhexis. Regarding the removal of a viscodispersive material, it is difficult, while in the viscocohesive material, it is easier, as it is moved as one block or one piece. Regarding the spontaneous clearance, the viscodispersive material is cleared in 24 hours, while the viscocohesive material is cleared in 48 hours. The intraocular pressure spikes are higher with the viscocohesive material. Let's see the removal of a viscodispersive material. And now, let's see the removal of a viscocohesive material. It moves outside the globe as one block. So, it is easier to be removed if compared to the viscodispersive material. And now, here comes the question. Can we use both of these materials in the same case? Yes, we can use both materials in the soft shell technique, in which a viscodispersive material is injected to coat the endothelium, while a viscocohesive material is used to maintain the space while doing phaco. So, there are lots of differences between the viscodispersive and the viscocohesive materials. And when you understand these differences, you can choose which one to use in different cases. Thanks a lot for watching!